right, half a day, and welcome again to the KUAM Podcast Network. We want to thank you for listening, wherever that may be, on Spotify, Apple Podcasts, or wherever you get your podcasts. And another edition of it. Jason Salas, he's a busy man, so I'll be filling in today. And it's time for another episode of Nurse Jenn Explains, which is a really complex concept. It's where Nurse Jenn explains things.
Right.
It's right there in the title. So Nurse Jenn, today's podcast is kind of a revisitation of something that is in the media pretty much 24/7. Whatever news channel you listen to.
Aren't you eating it, breathing it, sleeping it?
Yes.
You wake up to it. It's all over your WhatsApp chat groups.
It's everywhere. We are talking about the coronavirus, the pandemic. I don't even know the difference in those two.
Epidemic.
So you did this, a podcast about this pretty soon after it really broke, and you got the information out there.
Because I didn't want people to panic or worry.
But
today
in this day and age, people do panic. They do worry. Right. Obviously, we want to make sure it's, think of it as like preparing for a typhoon. You want to make sure you have all the facts. You want to make sure you have all the supplies you need. So today we are going to revisit the coronavirus, the information that is evolving by the minutes.
Yes.
And but a lot of it is about the numbers of these many people are affected here, but some things have not changed. Preparation, hygiene, things like that. So let's go ahead. How did you want to start?
First, okay, so you said you eat it, you breathe it, you sleep.
Yep.
Okay then, what are the 3 top signs and symptoms?
Okay.
Of hyper.
I did this research. Okay. I did a little bit.
You should just know it.
I skimmed it. You should, because
you should just know it, so you're cautious 24/7.
Right, because I did just have a vacation. I was off island. We went through Tokyo, but I mean we were prepared.
All right.
I don't know how many bottles of hand sanitizer we had. Yay. We had boxes of masks. We washed our hands pretty much every time we passed by a bathroom.
Good for you.
So it's little things like that you can do to prevent. But the symptoms, as you said, from what I was seeing, it's kind of think like an upper respiratory infection. If you've got the cough, the dry cough, and whatnot, that obviously is one of the symptoms, correct?
Correct.
Okay, I pass.
All right. Okay, so the top 3 that I just want everybody to remember until this whole thing passes: coughing, fever, and shortness of breath, or difficulty breathing, right? Okay. And so one of the questions that a lot of people ask, how can I tell the difference between if I just have the flu or a cold, or if I suspect coronavirus? Because especially you just came back.
Mm-hmm.
How do I know?
How do you know?
So typically, the cold or the flu is going to come with a runny nose or a stuffy nose, and also with body aches, right? So typically,
that's where I start to feel if I'm getting sick. It's like it kind of starts in the shoulders.
Yep.
You just feel that tense, like I didn't even do anything to work out. Why am I a little sore? And then it just kind of spreads.
Yes. So coronavirus, top 3 signs and symptoms that just anybody. If anybody just starts to tell you they're starting to feel sick, and if they say these top 3, it's the triangle, then those are the ones you do want to go and get advanced medical treatment for. That's a cough, shortness of breath, and a fever. If you have other signs and symptoms, most likely it's a cold or a flu.
Because there's always something going around. There's always the flu or the cold. So, and now with this, I mean, you can kind of call it a state of panic that the world is in.
Yes, I agree.
Every little thing. Oh my God, my ear, I have an infection. I think I've got the coronavirus. Right. Everybody needs to calm down a little bit. But these signs, like you said, the coughing, the shortness of breath, they're all signs. If you have a runny nose, it could just be, hey, you got a little cold or something.
So I've been a nurse for over 20 years.
Mm-hmm.
And for 20 years, my go-to is always the CDC and the World Health Organization. And I know on social media we have a gamut of different social media sites that say different rumors, gossips, non-factual statements.
Fake news.
Yeah.
Sensationalist news.
Yes.
The panic-driven news that, you can't expect.
And it's so hard to decipher. I mean, my family members keep sending them to me and like, is this true? Is this true? And I'm like, wait, who's the source? We gotta read the. So I'm gonna stick with my go-to, which is CDC and the World Health Organization. I've trusted them for over 20 years in my nursing career, and they've never done me wrong. So what are the 2 best things as recommended by the CDC, the World Health Organization, and myself, that you can do right here today and every day to protect yourself is number 1, hand washing.
Yes.
And number 2,
not just we
go,
want to get
go.
in depth into this. When you say
Nurse
hand washing,
Andy is going to elaborate because
yeah.
I was going to later, but let's let Nurse Andy.
This is not turn the faucet on, run your hands under. Okay, all right, shake it off.
Yes,
done.
That's
not
right.
That's not really hand washing. We're talking full on soap, lathering up. 20 seconds they recommend.
Gotta see bubbles. I gotta
Bubble it
see
up.
a lather, and I gotta see bubbles.
I go about halfway up my forearm when I do this, just to make sure, because sometimes you.
Yes.
So wash, lather, make sure you get all the nooks and crannies.
Yep.
20 seconds. Some people are saying sing the happy birthday song twice.
Correct.
That'll just
or the alphabet song from the letter A all the way to Z.
Right.
One time.
That's a legit hand washing.
That's legit.
Yeah.
And then what are the 6 areas you want to hit? Go ahead, Nurse Andy. What are the 6 areas?
Okay, so palm. Fingernails. Get all in there.
That's 2.
Back of the hand.
3.
Fingers.
You said fingers.
I said fingernails.
All right.
Fingernails are attached to fingers.
Okay.
Between your, I don't even know what that's called.
4, the webs of your fingers. You gotta have friction right here. Are the webs 4?
Wrists.
5.
And your whatever else is left.
The one that a lot of people miss, and I'm not gonna lie, lots of times when I go to the bathroom, I'm like, did I do it? I don't know if I did it. You know what? I'm just gonna turn on the faucet one more time. Is your thumb. You actually have to wash your thumb like this, because most people just wash their hands like this, so they're getting the front of the digits.
Okay.
Then they wash back here. This thumb never gets touched by soap. Over here, over here. Then they do the web, so they're doing in between, but nobody does the thumbs. So because you're always pressing buttons all day, you want to make sure that you actively, yes. I text with all my fingers because I'm
you're one of those? You hold it with your glasses.
But there are some super talented people like, I'm done. Dang, you're already done. So your thumb, if you can actively. So he's absolutely right. Very good, Nurse Andy. You have done your homework and you've listened to it. What's the second advice that I think nobody can go wrong is don't touch your face.
Right.
Let me tell you, this coronavirus, it wants to come into your nose or your mouth, it wants to come and it wants to hide and warm up in your lungs. That's how you get the respiratory problems and the coughing.
Is it airborne?
It is not airborne. It's
okay, because I know a lot of people, have. Sometimes the media they put out basic information.
Right.
There's a virus. If you're flying on a plane, you could get it, and it makes it seem like it's airborne, like just breathing the air I'm gonna get. But that's not true.
We'll talk about traveling too.
Okay.
Yeah. So.
Physical contact.
Especially when you're out and about, and I think because it's just so we just do it, right? Like the eyes itchy.
Yeah.
No, like without thought, unintentionally.
You got a stray nose hair or something.
Yeah, you just touch it. But I think today in the coronavirus COVID-19 pandemic, the pandemic that we're having right now, try your hardest to not touch your face, and it's so important to also teach your children to not touch their face.
Yeah,
and
that's good practice, even if there's not a viral outbreak.
Oh yeah, definitely.
Washing your hands thoroughly is always good practice. Not touching your face when your hands are dirty is also good practice.
Yeah. So if you have to touch your face here at work or at a restaurant or at the mall, you got to wash your hands first before, because so the coronavirus is spread by 2 ways. It's either droplet, so a drop actually enters into your nose or your mouth or your eyes, or it's contact. I actually touched you and I transferred it to you. So your double whammy if you have it on your hands and then you touch your mouth or your face because you've transferred it. So those are the 2 best recommendations. Mommy, daddy, all the kids, if you can implement that, hand washing and it's not touching your face.
It's just good hygiene in general, like we said. So good practice anyway, and now obviously it's more important with the spread of this coronavirus.
So coronavirus fact, it has actually spread faster than SARS and MERS, but it's not as deadly as SARS and MERS. I just wanted to, only 2% of the population has died. from
Yeah,
corona.
let's talk
and that's
about
not,
that.
I mean, I'm not saying only 2%, but 2% have died from
2% of the people infected, or 2% of
Infected,
the...
yeah.
Okay, then the numbers of that, 2% of the people infected, which is a small portion of the people on the planet anyway. So who is more likely to be susceptible to this virus, to it leading to their death?
So let's keep it real. We've just had 2 deaths in the United States, in
Okay.
Washington State.
Mm-hmm.
Both individuals were over 50 years old. I think one was 50 and one was 70 years old. In addition, both had other underlying medical conditions. So
Already compromised immune
yeah,
systems.
so either they already had diabetes, or they already had hypertension, or they already had renal kidney function issues. They've already had some sort of medical complication before they got coronavirus. They were also advanced in age. They were 50 years old and 70 years old. So the concept is, the more concurrent disease processes you have, and if you get coronavirus, then you're more in a critical state of
Right.
being.
It makes
if you have
sense.
that, right?
Someone young and healthy, no existing conditions, the chances of them dying from this are pretty slim, correct?
Correct.
Okay.
So what's my number one recommendation to everybody? To you, to you, to you, to you, to you, to you, to me. We all should get the flu vaccine this year.
Okay.
All of us.
Flu vaccine.
All of us.
Does that help with the...
Doesn't help with coronavirus. So they're
Mhm.
saying there is, on the cusp of research, there is a corona vaccine that's been, it's in the lab.
In development?
But I'm be honest with you guys. Whenever the medical industry creates any new vaccine or medication, we have to put it under clinical research trials for at least a year.
We've talked about this before with the HPV. We
Yes.
talked about that, how there are certain things that they're working on that, hey, this has
Yes.
shown result, but,
But
we don't want to put the stamp on it yet. It
yeah,
has
and then
to go through
you grow a
clinical
third
trials.
eye.
Right.
I mean, it might be good. I mean, now
Right.
you can see when your mom's coming.
Side effect, you
or
may have
your
another
Chapman's
eyeball.
in the corner, but yeah, I mean, we just want to make sure that that doesn't happen. So, while I think it's Australia that's proclaiming they've developed a vaccine for the coronavirus, it still has to go under clinical
And that's another
research.
thing is we've seen these stories, or scientists in Vietnam or Cambodia have discovered the cure, and that's all fake news or
Right.
it's exaggerated. So
Right.
getting the flu shot is good, because if you do catch the flu, then you're just more susceptible to the coronavirus making you even worse or possibly killing you. So the
Damn,
healthier you
Nurse
are.
Andy is in the wrong field,
Well,
ladies and gentlemen.
Nurse Jenn explains
Holy
things
smokes.
well, so I can pick
I'm
up on that.
impressed.
If you dumb it down to my level,
I'm not
where
dumbing
I'm
it
able
down.
to pick up on it quickly,
I'm not
then
dumbing it down. You're
the
just
general
very
audience-
educated and very smart. Good job for you. Now, are all hand sanitizers created equal?
good question. No, they're not.
They're not. Like, example, my daughter just bought me like 3 bottles. One's strawberry, one's blueberry, and one's coconut. Oh my gosh, they smell so nice.
I love the smell of
It's
coconut.
beautiful. Thank you, my
However-
beautiful daughter, for trying to take care of mommy. I appreciate it.
Mommy smells great.
Mommy smells
However,
great. However, you need at least 70% of ethyl alcohol in your hand sanitizer. It should say on the bottle and boast it kills 99.9% bacteria.
okay.
My strawberry just has a beautiful picture of a strawberry on it. There's no, it kills 90, so it's really,
It's fruity.
it's pretty.
Yay.
But I'll be honest, so most hand sanitizers, the initial creation of it was just to kill like E. coli or Staphylococcus or just anywhere, right? I don't even think my strawberry hand sanitizer is going to kill.
Sorry, I just touched my face. I had an itch. I feel like I'm going to be quarantined any second now.
Right. So I don't even know if it has less than 70% of ethyl alcohol, if it really even kills boogers.
Yeah.
I don't know.
So just
I
check
don't know.
the bottle.
Yes.
At least 70%.
At
Obviously,
least
the higher
70%.
the better.
Yeah. But it should have a proclamation on the very front that says they want to boast about it.
Right.
It kills 99.9.
Ours is the most germ-killing antibacterial thing you could possibly buy. Then okay, that's good.
Yeah.
Okay, so hand sanitizers. I've heard talk of wiping down with what kind of wipes? Lysol, the sprays. Are those effective? What can we use? People want that state of mind.
Yes.
I want to feel safe at home, and for whatever reason, if you feel like, okay, I need to sterilize my house, I just got a package in from off island, I need to make sure that's clean.
Yes.
What can we do to, at least sanitize it a little bit or clean it, possibly kill the virus?
So, true story. I had a group of people that came up to me and said, I'm going to keep it real. I make minimum wage, which, by the way, went up Sunday, so I'm sure some people are happy about that, right? Some are not, but some are, right? And she says, I make minimum wage. I shop at the dollar store. I can't afford those disinfectant wipes that are like $5-6 a canister.
Yeah.
So she had said, I go to the dollar store and I just buy a bottle of alcohol. And it's 99 cents for a whole bottle.
Is that effective?
So...
How do you just put it on a rag and then wipe it? I mean...
So I said, bring the bottle. And
so the
bottle had 60% ethyl alcohol.
Not enough. Okay, it's got to be 70
That's
or
what your
higher.
99 cents bought.
Okay. So you can go on the cheap, but you just have to check certain numbers like that. Like you said, at least 70%. The convenience of getting those wipes that have the bleaches or detergents or whatever it is in them. Convenience, hey, I have a wipe, I can wipe down the table.
Yes.
However, like you said, they do cost a little bit more.
Yes.
If you can afford it, great. If not, there are some other ways that you can.
So if you either read the bottle or you go to their website, it should say if it kills the coronavirus. Okay. So example, Home Depot has, I think it's called HDX wipes. On their bottle, it says it kills the coronavirus. Okay. You can't publicize that if it's not accurate. It's against the law.
And that brings up another thing.
Clorox publicizes it.
That brings up another thing that I wanted to bring up. The coronavirus is not new. That's why these products, they all say it kills the flu, it kills the coronavirus, it kills this. This is the newest iteration of the coronavirus, correct?
Yes, absolutely.
Okay.
Absolutely. So we've talked about hand washing. Please start doing it.
Yes.
We talked about...
don't touch your face.
Don't touch your face. How about can we still kiss each other?
Well, that would be
and
transmitting
shake each
the virus.
other's hand. Can we still? What about in church? Can we still kiss, peace?
I'd rather not. I'd rather not.
You're absolutely right. If in this time frame, hopefully it's just temporary, I would avoid handshaking and I would also avoid kissing at this time because it's transmission.
And the worries, you don't want to go in for a kiss with someone, your auntie, and maybe they're super worried. It's just that uncomfortableness.
He makes a good point. Maybe Auntie Judy doesn't want you to kiss her anyways because maybe she wants to avoid it. So maybe it's a win-win and we can all let our guards down and just hey, hi, how are you? What's up?
And we've been through this before, with the SARS outbreak. There were PSAs put out about, physical contact, shaking hands, kissing, things like that. Maybe not a good idea at this time. So with the coronavirus, and not that we have any cases on Guam, but just to ease people's minds, limiting that physical contact is, I think, a good idea. And what next?
Mask. Are they all created equal?
No, they are not.
Okay. How do you know that?
I know because my girlfriend did the research. And
there's a lot being sold now on social media. They're so cute. They have SpongeBob or they have a coconut tree on it. A tropical print. They're cute, adorable.
Like the strawberry hand sanitizer, they are not effective.
They're not effective.
Okay, so what do we look for when we're buying masks?
So the ones that they're selling that are just cloth, it looks like somebody just bought some materials, sewed it together and made it for you. That just protects you. That's protecting you so when you cough, you're not coughing on me. Your spit isn't cough. So you want to buy those. Those are for your own self. The ones you want to get if you're really worried about being on an airplane or traveling are medical issue types of masks. Typically, they have like a blue seal on it. And the blue seal in the front of this is the material that's made so if a patient coughs on you or sneezes on you, that the droplet stops right here and it never actually passes through the fiber and goes into my mouth.
There are layers of these things.
Layers. So,
obviously, these are scientifically engineered to do the job that they're supposed to do.
To protect you.
So the different layers to protect you. And the other blue one there you have.
Yes, that's another material. If you can feel the material, it's a little bit different.
This is a
surgical mask. That's also to protect you. Of course, this one's the best, and the reason why it's the best because it goes all the way to the top of your bridge and all the way to the bottom.
These are the kind that I was wearing when I was traveling.
This is
they have the little metal wire.
This is better than this. Yeah.
Yeah, they have the little metal wire which form fits around your nose. So when you put it on, you just bend it so it's comfortable, but still you don't want these huge gaps. And that's the one I was wearing. And like I said, I have a big face, but it's still covered from the bridge of my nose all the way down around my chin.
And I'm told they're selling these like at everywhere, like the dollar store. And
supply and demand.
It's $13, they said, for a box at one of the dollar stores.
So when the
but I don't know, again, the quality of it.
Yeah, when the coronavirus first came out, people did panic, started buying all these up, so they were super hard to find. But then businesses realized, okay, we need to bring in more of these, so they are bringing in more. If you do see them at a store, don't buy all the stock. You know, get what you need for you and the family, and don't buy them all out, because then that other family, that elderly person is going to go in looking for a mask. They're not going to be there because you and one other person have 10 cases that you're hoarding, which is not fair to other citizens.
I agree.
Thank you.
I very much agree, because now, like, I'm hearing all the prices for all these things are double, triple, and
reselling them is also, I don't think, a cool thing. People buying the boxes and then reselling them to make a little profit. I just think that's
oh
not
my
cool.
Gosh, yes, I heard that's the newest trend.
That's not cool.
They buy it for 20, sell it to me for 100. Like, really? Whoa.
That's, it's when things like this happen, people looking to capitalize on it monetarily. I'm not a huge fan of. So don't do that. You're not a good person.
Yeah. So what are some simple hand tips that we want to give people every day? Because we just talked about don't shake my hand, wash your hands, use hand sanitizer. Some other simple, when you're in the elevator, use your knuckle.
That's what I was doing, yeah.
Use your knuckle. Or do like me. I just go all the way to the back and I pray to God somebody presses the third floor for me. And then in the back I go, can somebody press the third floor for me? And I never touch the button.
Yeah. Or another thing I was doing is my driver's license. Just I had it's in my phone, or my phone, just boop.
That's a good idea. I like that.
It won't transmit as easily, but if you have something on you, plastic or a pen, something like that.
How about, do you think you can get coronavirus from infected money? I had a friend that works at a bank that said, don't you think I should get hazardous pay? Because everybody in the world says money is the dirtiest object in the universe. It's a universal. Everybody in the world. Don't you think that I can... So I actually did the research.
What are the chances?
It's like negative 0.03% chance that you can get coronavirus from dirty money. The study said the fiber that the money is made out of, the coronavirus doesn't live on that type of fiber that money is made out of for a long period of time. So it's a very, 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 very slight chance that you could get coronavirus from money.
I was worried, even though I don't have any money. Just in case I happen to come across some.
But you know what's really dirty, which I just read a report from a physician that highly recommends when you pump your gas.
Okay, because it's everybody's hands and the little rubber handles.
The gas pump handle is one of the dirtiest handles because it already has all the chemicals, and then it's outside in the heat.
Right.
So if bacteria touches the pump handles, and it's in our Guam heat of 100 degrees, so it's harboring bacteria and viruses on that gas pump. So one of the reports I just read this morning was a physician recommending that you don gloves before you pump your gas.
All right. I have
I don't even know. I think people are going to be like, Nurse Jen, I think you're going a little too far.
Everyone just wear a hazmat suit and surgical attire and you'll be all right.
Or you can be like Jason. Jason has never pumped gas in his car. Did you know that?
No, what?
Yes.
How has he gotten away with that?
Because he said he doesn't want to touch the icky handle.
He said icky, didn't he?
He did.
Really? Oh.
So Jason pays that extra. How much does it cost extra when the guy at the gas station? I know. I told him I pump my own too. I said I thought those were like just for older people. You know how the service guy comes out, full service, and he pumps your gas.
I figured.
I thought it's for older people.
Or someone with a disability. I fully support that.
Or a disability.
But Jason, wow.
Jason, our boy, Jason. Because you pay more for that, don't you? Pay like.
I don't know. I pump my own.
I know. I've never done it either. Full service.
Jason
Never done it. We're going to keep it real right here.
Yeah, absolutely.
So I'm going to keep it real. I cannot see myself using medical gloves
No.
to pump gas. So this is what I do. Pump it and then hand sanitize.
Right, keep hand sanitizer. I have one attached to my bag right now. I have one in the car. So pump the gas, hand sanitizer, thoroughly, boom, done.
That's what I'm gonna do. But if you want to take this physician's recommendation, go buy yourself a box of gloves and.
Or have, Clorox wipes in the car, wipe down the handle, maybe Lysol spray.
Yeah.
So you can basically detail
go.
the entire gas station before you pump your gas.
There you go. So I don't know if you heard the latest and the greatest. I wanted your input on this.
I want to hear this.
There is a private school, don't want to say the name, don't want to call them out. Private school made the first announcement Friday. We're anticipating probably other local schools are going to follow trend. The new policy is if you've traveled anywhere, anywhere,
right,
you're not allowed to come back to school for 14 days.
Okay.
And you have to have a medical clearance from a physician before you can come back.
Okay.
Now,
you're looking right at me when you're saying this because I just
what
got
is
back
your
on.
thought? Like, are insurance companies going to pay for a coronavirus medical clearance? How much is that going to cost?
Yeah, no kidding.
That's like a big thing now. Like, and then to keep a child out of school for 14 days that has 0 symptoms.
Right. And that's one thing I wanted to bring up. Well,
Yeah.
you bring it up actually.
Tell me what you think on that. I don't know.
We hear a lot in the news
they're
about the
protecting all my
incubation
kids.
period,
Yes. Yeah.
which I totally understand. They're saying 1 to 14 days incubation period, which is, to put it in medical terms, just where the virus is chilling in your body before it's actually starting to show symptoms or affect your bodily function.
Yes, correct.
So you could be fine, totally okay,
Yeah.
and then all of a sudden, boom. I read that the median is about 5 days
Correct.
for symptoms to show.
By
Could be
typically.
Less, could be more, but that's
Again, it
generally
depends on your age, your
Exactly.
immune system, how many disease processes you've been diagnosed with. Do you have diabetes? Yeah,
Right.
all of that. So that's why average 5 could take longer, could take shorter.
Yeah, and I understand why schools are doing that because
Me too. I understand
schools
too.
are a breeding ground for every
I agree.
cold, flu, everything that
And
kids.
how many times do kids wash their hands?
Kids, they pass it around,
Right,
they sneeze in each other's faces,
share
they cough, and
drinks.
yeah, so.
Here, it's your turn to drink it, your turn to drink it, your turn to drink it.
So I get it. If one kid shows
do
up to elementary school, they have played recess, they're out there, all of a sudden you've got 30 kids at school that are
Yes.
infected. So I get the reasoning behind that. Safety of the children, priority. But, what do you think? We don't want to shut the schools down. We don't want to shut the world
No, I
down.
don't. Correct.
We want to take precautions, but
So, one of the things people have said, do you think it's just an accident that coronavirus is not on Guam? And my true opinion, no. I truly think the government officials here on Guam, the local agencies, the local physicians, the airport, everybody was so proactive to implement all these strategies to prevent coronavirus. And thank you, all of you, all the agencies and the officials and the government agencies that supported us, this island,
Right.
to protect us against getting corona. I think all of that was a very well thought out plan. Is this another well thought out plan to now involve the kids and make sure the kids are protected? I think it's good.
I can see both sides of this.
I do too.
I totally could. So
I do
that
too.
kind of is up to the individual.
I'm okay with it. I think number one, because isn't the law say like you can't miss more than 14 days of school and then
It's been a long
something
time
like that?
since
Right?
I
I
was
was
in
in a
school.
long
I
time.
don't know.
I just remember people always saying you can't miss more than 14 days or you won't pass to the next grade. But what I do want to say is, can insurance companies cover a coronavirus
Well, I wanted to bring up.
clearance?
I've seen people talking about
so that I don't have to pay out of my pocket for
Yeah,
it?
nobody
'Cause
wants to
what
pay
if I
out
have
of their
6
pocket.
kids?
right. But you mentioned that the measures that all these different authorities took to prevent it from coming in. I've heard people talking about like, well, what if it's already here? Do we have testing? Are there testing available on island? Has anybody been tested for it? And there was that one incident of the man who he had contact with a Chinese man, but he was coughing, wasn't feeling well, went in, and it turns out it wasn't. So
The last report I heard was that CDC Atlanta was going to send testing kits to our public health.
So we
And
don't
then
even
our
have
public
them here?
health. No, we don't.
Okay.
The last I heard, they weren't here. And then our public health will start to do the testing 24 hours a day, 7 days a week. and should get results within 24 to 48 hours
Okay.
after, if there's anybody that's suspected of it. So the last conference I went to, we did not have the testing kits on Guam,
Okay.
but they are working with CDC Atlanta to bring it here so we can test people here on Guam.
Okay, so I mean, this is one of those things where there's a lot of moving parts.
But what if your job did that to you? You just came back. What if KUAM implemented you can't come back to work for 14 days?
Then I have a 2-week vacation on top of my 2-week vacation.
Is that going to be paid for?
Better be.
Oh, okay. So you'll get a whole month
No,
off of work.
When I got back, I talked to Marie about this. I messaged her. I said, hey, I just got back, and I'm really itching to get back to work on Monday.
Yes.
I've been gone for 2 weeks. I just want to get back into the groove. But
That's a kiss butt.
I
to
to-
Marie.
yeah, I
I'm
totally-
really itching to come back
Yeah.
to work. I really miss you, Marie.
but with the coronavirus and everything, and the fact that we did travel, we did go through Tokyo,
Yes.
despite us taking all the precautions that we've read about, everything that you mentioned, there's still that incubation period. And then not only that, but how would my coworkers feel me coming back if they're one of those that's super panicked, they're a germaphobe anyway. I know exactly who I'm referring to, but
Me
I'm
too.
not
I
gonna
know who he's
mention
talking.
her name. So if, is everybody going to be like, I don't want to go talk
Right.
to Andy, I don't want him in the
Right.
studio because he's going to be touching the things, and then the other DJs have to come in and touch the things. So, I asked, and, they said, hey, if you want to take time off, okay, but the fact that I took every precaution that I could, we avoided people for the most part, didn't touch handrails, didn't touch,
We need more people like you.
when you're
No, like
when you're
he's-
going through the store, don't just pick stuff up. Oh, nice, and then put it down. Like
I mean, this is like the perfect
No,
coronavirus educator.
Well, a lot of it is
He's
just
teaching
common
you not
sense.
to hoard, which I totally agree
Right.
with. He's taught you all the precautions to take. And look he went off while and came back, and he's fine because he heeded all the advice. And then he cares about all his coworkers and making sure that he's not coming to work sick. Those are all just the general guidelines and recommendations that we try to give everybody, but not everybody follows it.
If I was feeling any kind of symptom whatsoever, I would have stayed home. For
I have
sure.
mad respect for this man. Mad respect, because you don't know how many times people are like, why are you here at
Yeah.
work?
Right,
Why
hey,
are you
I gotta
here?
go. No, it's just a little something. I need the hours,
Yeah, and I'm like,
whatever.
can you just go home, please?
With
And,
this going on, it's not a good idea. You don't need to toughen up. You don't need to, I can do this of a man. Just, if you're not feeling well, stay home just for your health and everyone's peace of mind, everyone's...
Mad respect for this guy. I love it, because not everybody is as knowledgeable, and you can talk the talk, but do you walk the walk? And
It's
you
because
sound
I
like
listen to
you
Nurse Jenn
are.
Explains. Knowledgeable. KUAM Podcast Network.
And with that, I think we're going to end, because I don't have anything else to say. What else do you have? Add your last tidbits of recommendation, Nurse Andy.
Well, I mean, I think we covered most of it.
We
There's
did.
a lot of questions people have about, this. Is it spreading? Is it going here? Or, all the different symptoms. So I think we pretty much covered most of the concerns. Like I said, I did a little research on this before I was traveling because just safety's sake.
Where's the best place to sit on the airplane? The research study just came out yesterday.
My girlfriend mentioned something about this.
Where? Let's see if you know.
I don't know. Middle of the plane?
No.
Begin front or fore and aft.
The window aisle.
The window exit row, you mean?
The window. You're
aisle?
next to, the window seat. I'm sorry.
Window seat, okay.
So the research showed that 43% of people that sit next to the window don't get up the whole plane ride. They just stay there. They sleep. They don't interact with other people.
Right.
People that sit in the middle aisle get up at least 65% of the time. The person on the aisle seat gets up 80% of the time. So they're saying, just statistically, that whoever gets up has to keep passing, the middle person has to pass. So the middle seat's the worst one, because you have to pass over the aisle guy.
Okay.
The aisle guy doesn't have to pass over anyone. And the window person, just statistically, they say the reason why most passengers pick the window seat is because they don't want to be bothered and get up.
I picked the window seat because I want to lean against the window. I don't want to look out at the ocean because it's just water. I want to lean up against so I can sleep because I'm
Right.
not a very short person.
And you're probably also like, I don't want to bother this guy and wake him up because you seem like
Yeah.
a very considerate traveler.
But I just kind of,
Like-
once I get in my seat, I have all my
and
stuff.
that's what they
before.
say. People that pick the window seat, they usually methodically pick the middle seat and window seat because they
Okay.
don't want to get up and they want to sleep on the window and they don't want to be bothered to.
Right.
Excuse me, sir, can you get
Yes.
up? I got.
Oh man,
excuse
that
me.
guy's sleeping. Oh no, I don't want to get up. Okay.
Uh,
So I think a lot of it boils down to common sense, as you said, hygiene and safe practices. It's not like you need to wear a hazmat suit and avoid everyone in the world.
Well, this is your role model. He went off island. He went through Japan. He doesn't have any signs and symptoms.
Right.
He followed all the precautions that have been recommended by the CDC and the World Health Organization, by his physicians, everything. So he did it right.
I think I did my research, and before I even left off island, my doctor.
And it sounds like you didn't panic.
I had an appointment with him, and he just kind of, oh no, just wash your hands,
Yes.
you'll be good, you'll be fine. If the doctor's not freaking out and panicking, and just says, oh yeah, you'll be fine traveling, oh it's okay. If he just said no, don't go, then I'm like, all right, I'm not going anywhere. So if people do want the information, I know we covered a lot of it here, and you can see all the articles that are junk on social media. But if they want the actual factual information, where can they go? Websites and things like that.
Again, can't say it enough times. The Center for Disease Control has a very reputable website with lots of research data to prove all the positive attributes of hand washing, hand sanitizer, disinfectant, all the things that we've talked about today. The World Health Organization also. World Health Organization typically also tracks countries outside of the United States, not just us. So they're in China, they're in Korea. So they're tracking disease process out there because of the World Health Organization. And then your local public health department also is in communication with both public health and CDC. So they're on the cusp also of the latest and the greatest. And so those are my 3 go-tos. All the others, I don't know, ladies and gentlemen.
Yeah, as much as you love your auntie on social media, sometimes they may share an article that is not factual.
Yes.
So get the information from the people that know better, and like you said, the CDC and the World Health Organization, as well as public health. They have the information that you need.
Thank you guys
Don't
for hanging
panic.
out with us. Don't panic. And now you got the tools to protect yourself and your family.